seen a crowd leaning to learn. A mother asking what her choices mean. A classroom where a simple lesson turns a worried face into something bright and clean. That's the work, the quiet kind of change. One message shared and suddenly a whole community starts to see. Reach out with help, reach out with hope, changing hearts with every show. From the stories that we tell to the hands we teach to grow. ROI stands for everyone, where knowledge lights the way. Reach out with help, let's make tomorrow safe. There's a rhythm in the radio drama, a jingle kids remember on their way to school. Digital voices carrying truth, turning myths around, breaking old harmful rules. Reproductive rights, a safer choice, health promotion that gives people a voice. One clear fact, one open mind, that's how change begins to unwind. Reach out with help, reach out with hope, reach out with hope, changing hearts with every show, changing hearts from the stories that we tell to the hands we teach to grow. ROI stands for everyone, where knowledge lights the way. Reach out with help, let's make tomorrow safe. If you need a place to learn and speak, if your village needs a voice this week, if a lesson saves a life tonight, we'll share it far and wide. We learn, we share, we help. Reach out with help, reach out with hope, changing hearts with every show. Information, education, a movement people grow. ROI stands for everyone, where knowledge lights the way. Reach out with help, yeah, let's make tomorrow safe. Reach out, reach out, reach out with help, 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 reach out with help.
Hey, good morning, Abuja. Good morning. You are welcome to the Health Connect Forum today, and this is an initiative of Reach Out Health Awareness Foundation, ROHI. And before we start, we are streaming live on Facebook on Municipal FM 95.3 Abuja platform. Yes, you can go there and watch us live. And you can also listen to us on the dial, Municipal FM 95.3 Abuja, and on AMAC Community Radio 88.5 FM. Yes, so I am Jennifer Deere, and I will let my co-host introduce himself and also introduce our guest for today.
All right. Hello, Jennifer, and good to see you this morning.
Yes, good to see
Hello
you.
to all our listeners across the both platforms. That's Municipal 95.3 FM and AMAC Radio in Kadashi. Thank you so much for joining us on this wonderful program. My name is Imo Ebong. I'm your co-host, and with us here in the studio this morning is Dr. Ephraim Okon. Dr. Ephraim Okon is the Executive Director, Reach Out Health Awareness Foundation, popularly known as ROHI. Dr. Ephraim, good morning to you, sir.
Good morning, all. Good morning, Jennifer.
Good morning, sir.
Mo. Happy to be here.
It's good to have you here with us this
All right.
morning.
So let's quickly give our listeners, of course, taking into cognizance the fact that there are some people that this is the first time that are joining us on the program. This is Health Connect Forum. It's a flagship weekly radio program brought to you by Reach Out Health Awareness Foundation. Our job here is to bridge the communication gap between health intervention providers and the Nigerian public. Well, it's no news that Nigeria has hundreds of INGOs. Now, when we say INGOs, we're referring to international NGOs. NGOs generally are our own local NGOs, donor agencies, and government programs delivering life-saving health interventions across the country. Yet millions of intended beneficiaries remain unaware of these services, while policymakers and funders struggle to track real impact on the ground. Now, the Health Connect Forum solves this problem. That's why we're here. It is a dedicated platform where INGOs, NGOs, policymakers, and health stakeholders come on this show on the both stations, so you can imagine the mileage. You tell Nigerians directly about your programs, your interventions, and success stories. You also have the opportunity to connect with critical stakeholders, including community leaders, healthcare workers, and the media. You reach beneficiaries and communities who urgently need these services, but sometimes don't know that they exist. You also get to provide a meeting point for donor agencies to understand work being done on ground, assess gaps, and channel funding more effectively. So we encourage you. This program airs every Wednesday from 10:05 a.m. to 11 a.m. Yes, the West African time, on Municipal FM and AMAC Community Radio. So avail yourself of the opportunity and key into this platform provided for you. Now let's get the show started this morning. Thanks once again for joining us. Let's go into the meat of the conversation. Today we will focus on the activities and programs of Reach Out Health Awareness Foundation. As I told you, Dr. Ephraim is here in the studio. If we had to just talk to Dr. Ephraim alone and his experience in the field, I don't think 1 hour is enough, but we'll do the best that we can in this regard. The Health Connect Forum, amplifying health impact one community at a time. Let's dive into it. We'll kick off straight with you, Dr. Ephraim. Talk to us, talk to Nigerians directly, and tell us, give us an overview of what ROHI has focused on, at least in the past 1 year. Just a quick overview before we dive into specifics.
Yeah, thank you so very much. ROHI, originally registered as Reach Out Health Awareness Initiative, had to, reformat our name to Reach Out Health Awareness Foundation, ROHI. We maintain the ROHI because that has been our brand. Yeah, so we are into social and behavior change communication. For this particular year, we have an intervention ongoing in Oyo and Ogun State, and then maybe in the extension of Abuja, that focuses on using inter-religious leaders, Muslims, Christians, traditional rulers, as agents of messengers of the truth when it comes to access to reproductive health and healthcare choices for women, for girls, for the marginalized community. The essence of that program is basically, when you look at different audiences, you will know that religious leaders, inter-religious leaders, play a great role in getting messages, religious messages, social messages, economic messages across to their congregations. So how are they able to pass on health services related messages to their audience? So we thought that if we focus on reaching religious leaders or religious audiences through their leaders, we will be able to have critical spokespersons that will be able to give accurate information on access to services to their audiences. And what is the program? What is the program trying to achieve? We've heard about stigma, and then how problematic stigma is. Stigma in terms of access to health, access to health services. Yeah, so we train the religious leaders for them to understand what stigma is all about, and then bring about the process of making sure that they pass accurate information to their congregation in as much as access to health services in those two states and in Nigeria as a whole is concerned.
All right, Doctor, let me quickly jump in there now. Rohai, you always talk about information. So yes, Rohai focuses a lot on awareness and behavior change, and the driver there is information. So how critical is information in the whole of this? Because whether you are providing direct healthcare services, whether you are providing other forms of intervention, information plays a critical role. So can you speak to that? Looking at information and medicine.
Yeah, thank you so very much. Without access to information, accurate and correct information, whatever services you are providing might not get to the people the interventions are meant for. So what we do at Rohai is to look at what each NGO does. What are the interventions that you've designed for a particular people? Who are the stakeholders? Who are the beneficiaries? Were they carried along in the process of the design of these interventions? What exactly are you trying to achieve? Yeah, so we interact and look at these services, look at these interventions, and then make sure that we provide accurate information through the channels that we can reach the beneficiaries for them to know about whatever services that your intervention is providing. So access to accurate information is very, very important. It's vital for any intervention to be successful. For example, if there's an intervention that has to take care of let me use obstetric fistula for example, and then there is a hospital that is built for repairs of victims of obstetric fistula, and there is no way people will know that service exists. People will not have access to that services, even if you build the biggest hospital in town. So what we do is to demystify the myths around information to access. For example, most people believe that obstetric fistula is a death sentence to women. And because of what it is, the incontinence that comes with it, the incapacitation that comes to it to the woman, it is difficult for the woman to associate with others. Yeah, but when the woman and the husband and the community are well informed, they are able to know that obstetric fistula is not a death sentence, that the victim could be repaired, reintegrated into the society. So we connect services to the people that they are meant for. And that's what we do. Without this information, and then passing the information through the accurate channels, appropriate channels for the target audience, then the intervention will not be successful. So that's what Rohai does.
I'd like to liken this to going to the hospital and the doctor hands you a pack of medicine without any information as per prescription. Yeah. The medicine becomes useless because you can wake up in the middle of the night and swallow the whole thing, and the objective will not be met. All right, so before we go on our first break, there's sometimes a wide gap between the availability of the services and the knowledge, that the information that tells you this service is here. From your experience and background, have you seen communities, do you see communities take this information serious? Or it's just the usual jamboree? Sometimes they mix them up with political activities. You go for a health intervention, they tell you, just bring the thing, I beg, let's go, your government have paid for it. Without knowing that, look, this is somebody putting years of work and experience, to provide this service to meet a certain objective, which is to better the lives of the community people.
Of course, they do. And why do they do that? because when the information is accurate, and then the first set of people are able to access services, they become the connection, the bridge between the community and then the service. Through word of mouth, through whatever means, people are able to access those services. As soon as they are able to access the services, they take the information seriously because they have been connected to what they have been longing to have. Basically, there might be, let me give another example. There might be a primary health care center in a particular community, and people might say it doesn't concern them, without knowing that one can go there for antenatal services, one can go there for immunization, one can go there to seek for information. And what happens is that due to barriers, religious barriers, communal barriers, and other things, people tend to keep what happens to them to themselves. And through the services we provide, we are able to connect to people, with the problems they have. And then with that confidence, they're able to talk to you. And then we are able to connect them to experts in which they can confidentially tell the experts what their challenges are. And as soon as this information gets to the people and they know that they will be protected, they know that they will have access to what is worrying them, you see people taking it so very serious.
All right. Thank you very much. If you just joined us, this is the Health Connect Forum, and we're discussing and focusing on the activities and programs of Reach Out Health Awareness Foundation, popularly known as ROHI. Dr. Ephraim is our guest this morning on the program. We're broadcasting on Municipal 95.3 FM and AMAC Radio, Community Radio in Kadashi, if you're listening from any of these platforms. There's a phone number. Later on, we'll throw the phone lines open if you have questions or you want to make inquiries. And also later on, we'll give out a phone number if you run an INGO, an NGO, you're a government agency, and you'd like to be on the program to showcase your activities and programs as well. You can also get in touch with us. Jennifer is here in the studio. I'll tell you something about Jennifer when we return from this break. She was trying to escape earlier.
I've seen a crowd leaning to learn, a mother asking what her choices mean, a classroom where a simple lesson turns a worried face into something bright and clean. That's the work, the quiet kind of change. One message shared and suddenly a whole community starts to see. Reach out with health, reach out with hope, changing hearts with every show. From the stories that we tell to the hands we teach to grow. ROI stands for everyone, where knowledge lights the way. Reach out with health, let's make tomorrow safe. There's a rhythm in the radio drama, a jingle kids remember on their way to school. Digital voices carrying truth, turning myths around, breaking old harmful rules. Reproductive rights, a safer choice, health promotion that gives people a voice. One clear fact, one open mind, that's how change begins to unwind. Reach out with hope, reach out with hope, reach out with hope, changing hearts with every show, changing hearts from the stories that we tell to the hands we teach to grow. ROI stands for everyone, where knowledge lights the way. Reach out with health, let's make tomorrow safe. If you need a place to learn and speak, if your village needs a voice this week, if a lesson saves a life tonight, we'll share it far and wide. starts with every show. Information, education, a movement, people grow. Grow High stands for everyone, where knowledge lights the way. Reach out with head. Yeah, let's make tomorrow safe. Reach out, reach out. Reach out with head. Reach out with head. Reach out with help. Reach out with help. Reach out with help. Reach out with help.
Okay, welcome back from that break. Yes, so before we went on that break, we were talking about information that Raw High gives to the people, right? And before we continue, don't forget we are streaming on Municipal FM 95.3 Abuja and Karashi Community Radio 88.5. And we are also live on Facebook right now. Yes, so let's go deeper. You are giving out information. So what does implementation actually look like? Like, don't speak big grammar, please. Let's say it in simple terms for everybody to understand.
Yeah, thank you so very much. To us, implementation is basically the process of actually getting your program to the community, to the people. How many people have you reached? For example, you are maybe talking about family planning services. How many people have actually gone to the hospital to access that service? And then how do you connect with those people? Do they really take it serious? Are they following up with whatever they are supposed to do? What services have they taken out of available choices? So basically, implementation to us is interpreting what you plan as an intervention to happen on ground and let people access the services.
All right, so you talk a lot about experience and field work. And here's a critical question. Between the healthcare itself and what people really think about these services, providing healthcare, which is harder? Is it providing it or passing the right information to change the people's attitude, their behavior towards the service that is being provided?
And they are both very critical.
Okay.
Yeah, because if you provide information for things that are not there, you are providing information for services that are not there. You are programming people to change behavior, to adopt positive or informed behaviors, and the tools that they are supposed to use are not there. You are causing more problem. You are causing more harm than good. Yeah, so it is important for the services to be provided. For example, it is important for the primary health care service that targets pregnant women to have a nurse, to have the nurses and the doctors, and then the facility itself for the people, for those to benefit from those services to be available, to access. And then when those services are available, it is also very important for that intervention to make sure that accurate and correct information about those services are made available to the people that need it. And that can be through different forums. For example, the primary healthcare center has 1,000 HIV kits and is available for the people to access. But people don't know what it means for them to go and get tested for HIV. So there's a disconnect there. That's where health awareness information comes in. That is where our intervention will stand in between, would stand in between the gap to make sure that that service that is available, the people are aware of it, they know what to do in order to access those services. And you know that there are barriers to information.
Absolutely.
It can be religious barriers, it can be communal barriers, whatever the barriers are. The information that we are providing is supposed to break those barriers so that people will believe in the services that they will access. It is one thing for the government to provide, or the government or the NGO to provide family planning gadgets or kits, or to provide condom, for example. But it is another thing for people to believe that those are effective tools to stop the spread of something like HIV, or for a pregnant woman that needs antenatal care to go to this primary health care to access services. So these are very, very important. The services has to be there, the facility has to exist, and then when you give the information to the people and then they understand the need, they will become even the bridge to the services themselves, because they understand how important it is for them to access those services.
Just before we move away from that line of thought, there are several organizations, NGOs and including INGOs, that have very massive projects, sometimes regional projects, sometimes nationwide projects. And you see that these projects only begin in the communities and on reports and project papers and end there. Sometimes there are near zero activities bordering around awareness and information communication. So you see that outside the immediate community, nobody else knows what is going on there. So very poor or very weak communication strategy and outreach. What do you say to these kind of organizations, and how does this impact such projects?
Yeah, thank you so very much. There's something called co-creation. It is now very, very important to make sure that the stakeholders, the beneficiaries in the communities that you are designing an intervention for, are part of the design process. Because you cannot design something that, you cannot design a program or intervention that the people don't know about. It is as if you are designing something for people that don't need it. Yeah, so whenever interventions are being designed now, the communities, the beneficiaries has to be carried along. The stakeholders have to be involved. They understand the dynamics of each of these communities, and then the importance of getting the services across to them. When the beneficiaries, when the stakeholders are part of the design process for a particular intervention, they will take ownership and there will be sustainability with those projects.
Does this impact the outcomes of such projects or interventions?
Of course, if the stakeholders are not involved, if the communities are not involved, certainly they will not take ownership.
All right.
Yeah, so certainly they will not take ownership of the project.
Okay.
And that's why we are creating this forum. It is not just about, designing interventions and spending money for interventions. It is about making sure that it gets to the people those interventions are meant for. And how do you get the program to get to the people? Through making sure that the process of passing the information, not just to the immediate community alone, to scale it up to other beneficiaries that are part of the target audience, you make sure that access to those services through adequate information is part of the program itself.
Okay. Similar to what we're doing right now, is ROHI, I want to refer to ROHI now as a specialist organization. This is your turf. Are you open to partnerships, working? You mentioned co-creation. Does that refer to you working with other organizations to provide the information, communication, behavior change aspect of the project or their projects? Are you open to such partnerships?
Of course, we are open to partnership with organizations that need our services. We can come in as a niche partner.
Okay.
in which our expertise in terms of 360-degree communication is needed, or maybe as strategic communication partner. So we can come in as a niche organization. And we can also come in to partner with you from the design stage, from the proposal writing stage, where we come in and then we look at whatever the call is all about, and then we design the social and behavior change communication aspect of the project with the other partners for the intervention. It is an opportunity for NGOs to also come on air to talk about their interventions, not just here, but what's going on in the grassroots. You can also partner with us to also spread the message. There are so many ways of getting your target audience. Yeah, it can. We have the Gen Z that use their phone 24 hours and also. So we have a way of working through multi-channels to get through to you. We have the traditional radio and TV, and then we can also design interventions that you can get it across through the social media handles and through the digital space.
Okay. Just in a moment, we'll give out a phone number you can call to join the conversation if you have a question or a comment on the conversation so far. But Dr. Ephraim, you talked about radio and multi-channel approach to information communication. There's this perception now that radio does not hold that power any longer. Radio has greatly been impacted by the emergence of the digital media space. Do you agree with that? And how does this play out in the development landscape where you operate? Do you agree? Do you share this opinion that radio is not as powerful as it used to be?
I would disagree. Yeah, because if you look at the statistics in Nigeria, about 60 to 70% of the people, especially in the rural and semi-rural areas, use radio as their source of information.
Okay.
About 70%. And then just go to the farmlands, go to the villages, you see people with their radio or either on their leg or set up somewhere listening to programs. And then they will tell you each program by name, especially the programs that they are so hooked to. Yeah, so that assumption might look real when you look at the urban area, but certainly it's more than 70% of the populace still use radio as a source of information.
Okay. Well, Jennifer, you heard that. So if you were going to feel bad, please put it on the reverse. So let's encourage our listeners. If you have a conversation, or you have a comment rather, or a question you'd like to put across to us, you'd like to feature on the program, do well to get in touch with us, and we definitely schedule you. It's a marketplace for health information, education information. It's an opportunity, a desk where you can actually showcase your work and maximize the output from your project. You heard Dr. Ephraim, Rohai is open for partnership. We can come in as a niche organization and handle some aspects of your project to ensure that there is a bridge between the service and the service provider and the community through the use of information and communication. Jennifer, you want to help us with the number? Is it the 091?
Yes.
Okay,
091 2259 6595. I'll call the number again. 091 2259 6595.
All right, so you can call that number right now and you join the conversation if you have a comment or a question. So, Dr. Ephraim, let's quickly come back to you now. We talk about the media. You want to put us through this process, the media generally. You talked about the Gen Zs. How do you work to ensure that you carry those in the local communities, the person who is in the farm, the person who is somewhere in the bus stop, the person who is stuck on their digital device? How do you work with these different groups or demographics when it comes to communication, change communication?
Yeah, thank you. What we do is development communication.
Okay.
And it comes with a lot of research. It comes with lots of studies. For each of our program, we have a process. And the first one is to have a baseline,
Okay.
which is basically the general thing for you to understand what the areas and the people you are going to work with. But specifically for our programs, for us to be able to get to design programs that affect the different demography of who we are looking at, we have what we call the formative research, which basically is to inform each of our programs. And when we talk about target audience, a particular program might have a target audience that ranges. For example, you can have a radio program talking about health or education that might be targeting people from 18 years, for example, to 49 years. Basically, it is not all of the people between 18 years and 49 years that you can get on radio or you can get on TV. Yes, so we do very thorough research to be sure that we define what program we will put for people that are from 18 years to 18 to 24 years, and then from 25 to maybe 30 years, from 30 to the 49 years, for example, just giving a range of ages now. So that the same program that we are designing for people on radio, we have a way of designing that same program for people that are going to use their smartphone to access those services. We also have a way of making sure that people that can't afford smartphones can use their normal phones to access our services also. That's why we talk about multi-channel programming. That's why we talk about 360-degree campaigns. That's why we talk about development communication. You can't develop one set of strategy for a holistic population. You need to be very certain how you will reach the Gen Z, how you will reach the people that are actually listening to radio, and how you'll be able to reach the people that are using the digital space.
Okay, so let's expand this conversation. As Rohai, what are the next steps for you? People will wonder, how do you get funding? It's a question that usually comes. How do you get funding? How do you fund all of these programs? How can people work with you? Can people volunteer to work with Rohai? People who have the interest of their community, people who are good-spirited, who want to help their immediate community. Can they work with Rohai? Can people volunteer to work with you to ensure that you achieve or advance your work, you achieve your goals and advance your work?
Yeah, thank you so very much. The funding landscape is changing in Nigeria.
Okay.
And you've heard about the destruction of the USAID by the Trump administration and all that. That has actually affected what funding comes into Nigeria, because most of the grants that were given through USAID or their partners, they've all been, basically destroyed, and those fundings are not coming. So we have to look inward to see how we raise funds to support our project. And one of the ways is through people volunteering to work with us. And then we also contributing what we can to make sure that we fund our programs. And then we look out for other opportunities to, when we see calls for proposals, we look out if it is something that is within our scope, or something we can do as reach out, then we go out for it and showcase our expertise and then convince the donors to support us. If it is something that is beyond the reach of reach out, what we do is to form partnerships with organizations that are bigger than us.
Okay.
We provide our own expertise, which is the social and behavior change communication aspect of it. And then the other partners who come in to provide, to also provide their own expertise. And we come in as a consortium for us to submit a proposal for whatever opportunity comes up. And we also reach out to individuals and corporate bodies in Nigeria through the ones that have corporate social responsibilities to support what we do. And we have a board of trustees too, and who also are actually dedicated to making sure that the goals, the vision, and the mission of Reach Out is achieved through their support. So there are so many ways that we can work with different organizations, and we are open to working, like I've said earlier, open to working with other partners, other organizations, to be sure that the mission and vision of Reach Out, which is basically to make sure that accurate and accessible and correct information to health, educational, and developmental services gets to the people as much as possible is achieved.
Okay, before we continue, let's quickly do that again. Reel out your contact, how potential partners, volunteers, and other partners can reach you to work with Reach Out Health Awareness Foundation.
Yeah, thank you so very much. They can reach us on email on info@reachoutwithhealth.org, and they can also reach out on phone. Can be through call, can be through WhatsApp on 070 30 44 8318. 070 30 44 8318.
All right. Thank you for sharing that information. And the website is www. Because that's like the box.
Yeah, the
where all the
website. Our website is www.reachoutwithhealth.org. Reachoutwithhealth.org.
Okay. Quickly, one aspect I'd like for us to touch is the role of policymakers. In terms of policy formulation, existing policies, do we have an enabling environment, an enablement by the legislation or legislature? Is there anything that needs to be done? Is there anything that needs to be changed surrounding what you do as ROHI? Let's assume that a legislator is listening right now.
Thank you so very much. The most urgent need for not just about ROHI now, but for development work as a whole, understanding the changing funding landscape in Nigeria, the decimation of USAID and its effect in terms of foreign funding coming into the country. The legislators, the National Assembly should look inwards to see how to legislate to fund the gaps that this has created. Yeah, and we need to also start thinking of making sure that development funding, healthcare funding, infrastructural funding are consistent, and then they go to the project that they are supposed to go to. We as NGOs, we work with the government. We are not doing the work of the government. We actually work to complement what the government is doing. There is no NGO that can actually perform the work that the government, be it at the local government, the state, or the federal, or like in the case of FCT, there is no NGO that can actually do the work the government is doing. Cannot. You don't have that kind of funds. But what the NGOs do is to basically complement the government where there are gaps. And this is basically where the challenge comes in. The government has to also understand that funding and foreign funding cannot take the place of services that the government can provide for the people. So the government has to do its job and make sure that whatever is budgeted for infrastructure, for healthcare, for education, goes to provide those services as much as possible. And then whatever the NGOs do will be to complement what the government has done. In terms of policy, Nigeria has so many good policies. They have policies in place. It's basically the political will to make sure that these policies are implemented to the letter.
To the good of the people.
Yeah, to the good of the people.
Well, usually we would say when the conversation gets sweetest, the time is usually smallest. We should begin to wind down this conversation. I was personally looking forward to the comments and questions from our listeners. But however, do well to get in touch with Rohai. If you're an organization, you can simply go to the website. That's www.reachoutwithhealth.org, right?
Sure, yes.
All right. Read www.reachoutwithhealth.org. There you find every other information. Let's see. Can we still try the phone line? 091-222-091-22-596595. Otherwise, do well to leave us a comment on the Municipal FM Facebook page where we're streaming live as we speak. As we begin to wind down, Dr. Ephraim, any final notes for our listeners out there?
Yeah, so on the final note, interventions are meant for the people. And if they don't get to the people, the people that are supposed to have access to these services are not part of the design of these interventions, most likely those interventions will fail. So there's need for the people to have accurate information about whatever interventions are designed for them. And this platform, this Health Connect Forum, presents a very good platform for organizations, INGOs, NGOs, to come in and tell the people of Nigeria, the people of Abuja, the people of FCT, what they have for them, what they have in stock for them. What interventions are you currently implementing in Abuja? Are you currently implementing in Nigeria? Come on, let's get the people to connect with you.
All right. Jennifer, I think we've had a great show so far. Looking forward to expanding the conversation by the day.
Yeah.
Next week, Wednesday, we'll be back with another conversation here on the program. My name is Imo Ebong. It's been a great pleasure having you on the show.
Yes, and I am Jennifer Dear. Thank you, Doctor, for giving us the time today. And you have a wonderful day ahead.
Thank you.
I've seen a crowd leaning to learn, a mother asking what her choices mean, a classroom where a simple lesson turns a worried face into something bright and clean. That's the work, the quiet kind of change. One message shared and suddenly a whole community starts to see. Reach out with